Our features editor Sharon Momanyi now as she crunches the COVID-19 numbers for us.
The numbers became faces. The faces have become people we know.
We are truly well within the third wave of this virus. And it is a wave that threatens to erase all the gains we have made as a country in fighting the pandemic over the last 1 year.
On Friday, Kenya recorded 28 deaths from COVID-19, the highest number of deaths from the virus in one day since the onset of the pandemic. In the last 24 hours, 747 new cases were recorded, representing a positivity rate of 14.5%, sustaining the double-digit positivity rate witnessed in the last 2 weeks. 17 more people died, taking Kenya's death toll to 2,011. The first 1,000 COVID-related deaths occurred within 217 days of the pandemic. But the next 1,000 deaths occurred within a shorter period of 143 days.
Kenya's case fatality rate is slightly higher than the regional average. And this should be a concern for Kenya, that something is happening in as far as the type of exposure is concerned, and the public health measures would really be important at this stage to try and reduce that.
This is what the graph of the coronavirus infections looks like since the first infections were reported in March 2020. Dr. Ahmed Ogwell, Deputy Director at Africa CDC, says Kenya in particular started to witness this third wave at around the third week of January 2021.
These waves come as a result of us as individuals relaxing in the way in which we engage with one another. Because the virus is generally passed from one person to another. When we relax and we begin to engage in environments that encourage transmission, then the numbers will go up.
The number of people being admitted in health facilities with the virus has been rising at an alarming rate. Altogether, 1 in every 5 people admitted to intensive care units or ICUs have COVID-19. Furthermore, younger people with no comorbidities are increasingly presenting severe illness from the virus. It's something changing.
Last year, we had a smaller group of people that were exposed to the virus. And these were generally people who have a lot of movement. There'll be travelers, whether it is within the country or outside the country. Those are people who are more exposed. There will be people who work within crowds. So it was a certain profile of individuals who were exposed. Now we are getting more of the population getting exposed, and therefore the pattern is changing.
And while this happens on one hand, on the other is the concern about the existence of other variants of the virus that could even be resistant to existing vaccines.
We have identified small numbers of the variant that originally described in the UK and the variant that was regionally described in South Africa. We see small numbers of those, largely by travelers, and so this is not a source of concern in Kenya right now. There is no active community transmission. A variant becomes important if it is being actively transmitted within the population.
In the past few weeks, the numbers have been alarming, numbers that have translated to devastation for families and friends. And as public health experts continue to advise, the direction the curve takes next squarely depends on decisions that you and I make. Sharon Momanyi, KTN News.
Great, thank you for staying with us on Checkpoint. That's where we leave it, especially for our viewers on KTN Home. Thank you for watching Checkpoint. For our viewers on KTN News, we have lots coming your way, including that conversation touching on Deputy President William Ruto, and of course what happened in Machakos, and the calls touching on ANC leader Musalia Mudavadi.